Hello, Better Blue Bio. We are Team Hummingbird, and welcome to our presentation entitled Investment Potential for BBB032. We are excited to display the market potential of your drug and hope this aids you in finding investors for developing and commercializing your product. Without further ado, here is what we have found. We were tasked with assessing the PPD market and displaying the market potential of BBB032. Just to give you an idea of what we have found on the sell side, we recommend that limited partners and venture capital entities interested in early ecosystem biopharmaceuticals should invest in Better Blue Bio's BBB032 therapeutic because of the unmet needs in the PPD market, the potential market capture due to the use of a penetration pricing strategy. And finally, we calculated the peak revenue of BBB032 in 2032 to be approximately 366 million. To give you an overview of what PPD is and who it affects, PPD is a type of mood disorder associated with pregnancy. The specific causes of PPD typically are linked to physical, emotional, social, and chemical circumstances, and in the US is found to affect 1 in 8 pregnant women. Additionally, clinicians typically refer to the types of PPD as the baby blues, which can last between a couple hours to a couple of days, postpartum depression, which can last weeks and is the most common form of PPD, and finally, the most severe form of PPD, which is postpartum psychosis.
So here we see a clinical diagnosis flowchart, which details the process through which many women are diagnosed with postpartum depression. It begins with a screening tool, typically given 6 weeks after birth by a healthcare professional that has worked with the woman with the party through their pregnancy. These screening tools are multi-question assessments like the Hamilton Depression Rating Scale or the HAM-D and the Edinburgh and Postnatal Depression Scale. After the severity of postpartum depression is determined, women with severe cases are referred to emergency mental health services, and women with moderate cases work with a prescriber, care manager, or psychologist to determine treatment. A treatment regimen is then established. These treatments range from mental health care to prescription drugs. Currently, most of the treatments for postpartum depression have been adapted from treatments for major depressive disorder, or MDD. Many MDD treatments' effectiveness in treating postpartum depression is understudied, and many of the current treatments take 4 to 6 weeks to see results. These treatments typically take the form of SSRIs and SNRIs. These are 2 different kinds of antidepressants that are often prescribed for postpartum depression. Psychotherapies, so work with a mental health professional, typically talk therapy, electroconvulsive therapy, and complementary health practices that can range from anything like yoga, aromatherapy, and studying different mindfulness techniques that can be used in the home and with the newborn. Currently, there is only one FDA-approved pharmacotherapy treatment that has specifically been made for postpartum depression, and that is Zulresso. This treatment includes 60 hours of continuous IV infusion over the span of 2.5 days. Currently, Zulresso treatments and injections are only available in select inpatient clinics around the country.
So we already established that Zulresso is currently the only FDA-approved drug in the market. However, there are 4 potential drugs that are undergoing phase 4 clinical trials, including Zulresso, but this time for home care management, as well as 2 drugs undergoing phase 3 clinical trials. And there's the potential that these drugs will enter the market in the next 5 to 10 years. Now, one of the drugs in undergoing phase 3 clinical trial is known as the SAGE-217, which was developed by Sage Pharmaceuticals, the same company that has developed Zulresso. And we believe that they have developed SAGE-217 because they want to meet the need that is currently in the market, because Zulresso presently is administered intravenously by infusion, and that poses logistical, technical, and financial challenges. But the new drug, SAGE-217, is tablet form, and it's going to be taken orally. And so this is definitely going to be a potential major competitor in the market in the next 5 to 10 years. However, one thing that we should take note of here is that all of the drugs that are undergoing clinical trials, except for SAGE-217, are all existing drugs that are presently used to treat other depressive disorders. So here is a list of all the drugs most of the drugs that are currently undergoing clinical trials. We have the drugs listed here, the route of administration, the indication, and as well as the adverse effects. And we would like to focus on the adverse effects. Starting with Zulresso, the only drug that is in the market right now for PPD, we see that there is excessive sedation and sudden loss of consciousness. Other drugs also have serious side effects ranging from suicidal thoughts to insomnia to stroke to fatigue and maybe respiratory disorders. So we believe and we are very confident that BBB-032 has a competitive advantage over all the other drugs that will be coming into the market in the next 5 to 10 years, because our preliminary studies indicate that it has minimal side effects.
In order to calculate the PPD market size, we found the total fertility population, which includes pregnant women that experience abortion and stillborns, to be 4.5 million. We found the total amount of women who experience PPD to be 568,205. Finally, we found that from the approximate 500,000, only 60% of women are diagnosed and 50% are actually treated for PPD. Therefore, our target market size estimation was found to be 170,462 people. We also identified all the drugs that are offered to treat PPD and compared them by price. Of course, Zulresso is the highest, and we hypothesized that they are adopting a skimming pricing strategy. In order to combat that, and in order to take advantage of this new market, we recommend adopting a penetration pricing scheme in order for BBB-032 to capture more market through 2032. In order to price BBB-032 under this pricing strategy, we recommend that it be priced at $8,000 with an annual price inflation rate of 4.2. This assumption and others such as the variable and fixed costs, projected revenue, and peak profit margin is covered in Appendix A. So to conclude, BBB-032 will be able to gain market share using a penetration pricing scheme that can outcompete Zulresso. And now Jacob will briefly detail how.
Thank you, Xavier. So this chart here shows a few of the many SSRI drugs that healthcare providers sometimes use to prescribe to treat PPD. As mentioned earlier, these are also on clinical trials and in different phases for FDA approval. The total population of patients treated for PPD largely differs for these antidepressants because they also include patient population that suffer with other kinds of depressive symptoms. This also results in revenues that highly differ because they cover for treatments much more than just PPD symptoms, and therefore would not be a good comparison to our asset BBB-032 and Zulresso, the two treatment options that only focus on PPD symptoms. So because Zulresso has remained as our main competitor as the only FDA-approved PPD drug, we compared expected revenue potential for BBB-032 and Zulresso with the same population of 170,462 people, as Xavier mentioned earlier. Our data states that 2020's revenue for Zulresso was $6.4 million. Given that the cost of dose per patient is at $7,854, which is a conservative estimate considering other sources mentioning that the total treatment cost can go up to $34,000, we have arrived to the conclusion that only about 815 people at best have used Zulresso for treating PPD in 2020. Alternatively, our asset BBB-032 is expected to produce estimated peak revenue of 136 million in 2020, with about 10% of the patient population using our product, with increased patient population using our product over time by 1%. By 2032, you can even notice a bigger revenue differences between BBB032 and Zulresso. Despite the higher initial price set out for BBB032, we expect a larger amount of individuals diagnosed with PPD use our product because of its effective and easy to use nature. Furthermore, we expect that our revenue potential by 2032 will be much higher than Zulresso as a result. Because of the considerations mentioned, we conclude that there is much more commercial opportunity with BBB032 than Zulresso.
Viewing the whole picture of payers market, there are many people suffering under PPD that are also struggling to pay for the therapy. As mentioned earlier, not only the Zulresso vial is expensive by itself, but there are also significant extra costs associated with 2-night clinic stay and securing childcare. As a result, the high overall cost of Zulresso leads to a huge gap between demand and supply. Sage Therapeutics, which is the company that develops Zulresso, offers 3 financial assistance programs, but only a limited population are eligible to apply. However, on the demand side, low-income women are more likely to have PPD due to prevalent psychosocial stressors such as housing instability and lacking social support. This gap between supply and demand leads to nearly 60% of women with PPD not receiving a clinical diagnosis and 50% not receiving treatments. Regarding the FDA approval process, we expect little risk associated with getting the approval. The expected cost of FDA clinical trial to introduce a central system nervous drug is $51.3 million. The approval process takes place within a structured framework that includes, first, the analysis of target condition and available treatments, which is already completed for our drug. Second, the assessment of benefits and risks from clinical data. And third, the strategies for managing risks. Our drugs outcompete Zulresso in all 3 aspects of efficacy, benefits, and risks. So there is a clear evidence that BBB032's benefit outweighs its risks. Coming to strategies for managing risks, Zulresso has been approved with the risk evaluation and mitigation strategy, which means it is only available for patients through a restricted distribution program at certificated healthcare facilities. In comparison, our drug doesn't require such a stringent implementation procedures, so there should be no expected high cost or risk when coming up with strategies to manage risks.
Go ahead.
We are confident that our drug will perform better in payer markets and will go through the FDA approval process smoothly with little risks.
We have analyzed BBB032's market potential under a number of different factors, including competitive advantage, market size, commercial opportunity, regulatory environments, and the payer market. Overall, we recommend investors partner with Better Blue Bio and to both help women living with PPD and to gain access to a new market. Thank you.